Hello, I'm Dr. Diana Bitner with True Women's Health. We're here tonight to talk about weight loss medications. And our goal tonight is to talk about that there are safe options of medical treatments for weight loss. And I care about this. And why I started True Women's Health is I wanted women to know why. In terms of weight loss, I want women to know why they've gained weight, why they maybe can't lose weight, and how to best get about the process. So I have asked my partner, Dr. Egan, to join us here tonight to talk about weight loss medications. We've asked Dr. Egan to work for True Women's Health because she not only is a lovely human and a great physician, her patients love her because she listens and she understands and she really sees people for who they are and what they care about, but also because she is an internal medicine physician and she's board certified in obesity medicine. And so she knows so much more about insulin resistance than I ever have. And I'm so grateful that she's going to be here with us tonight to talk about weight loss medications. Dr. Egan?
Hi.
Why do you care about this? Why did you go into this field?
Simply I felt like there just had to be more to the story, right? Because I think that hearing from, my family, women in my family, and even myself, right? It just sometimes at times didn't make sense that I was like, I don't feel as though I'm eating so much that I should be gaining weight or that this person should be gaining weight. And then my patient should be gaining weight. Right. It doesn't feel as though that they're exercising and that they're not losing weight. So what the hey is going on? And so I
Exactly.
kind of took it upon myself and started doing all the requirements to get board certified in obesity medicine. And I really fell in love with it. I think it's a great combination of, psychology, pharmacology, and biochemistry, which is kind of a good summary of what's going on in the body. And I know tonight we're going to talk a lot about the pharmacology part.
Which I just love because, again, one of the most common reasons that women come to clinics for midlife or menopause or women's health is, why can't I lose weight? I'm doing exactly the same thing I always did. So, of course, one of the answers that I've found that helps make sense is around the hormone piece. And of
Yeah.
course, the fact that you've done this deep dive into pathways, I just love that we're marrying our expertise so we can take care of women.
Yeah. And I think that a woman going through menopause, I think, you and I, we hear this story all the time, which is I'm eating exactly the same. I have my exercise plan, yet boom, I've gained 15 pounds.
Mm-hmm.
Like what happened? Right.
Mm-hmm.
And a lot of women take this upon themselves. Like, I must be eating all the wrong things. This must not be the right workout. Like if I only read one more book, if I only worked out for one more hour, if I only spent one more night hungry, I could get it. Right. And it just didn't seem to make sense. And so I think a lot of this is a bit of a shift in your head from, extra weight that we need to lose isn't necessarily like a mismatch of the burning, right? It's a piece, right? The foods we eat, our exercise is a piece of the program, but really it's about signals. So there's signals going from our brain to our fat cells to say, do we expand, do we shrink, or do we maintain, right?
Mm-hmm.
And those signals they come from all different parts. They come from our gut, our liver, our ovaries via estrogen. And so our brain collects all those signals and then sends a signal back to our fat cells to kind of tell them what they should do next.
Well, even, so all of that in a very practical sense, I think about, I saw a patient recently, and of course, like so many of us, she's got stress at work, at home,
Mm-hmm.
with COVID. Do we go to the functions? Do we not? Do we wear a mask? Do we not? Do we test? Do we
Yeah.
not? Like, so there's all these questions. So it's not only this all this stress, but then, it's the not sleeping. So I love how you talk about signals, because, for example, when we get stressed out, we're signaling to our body, right,
Mm-hmm.
to store fat.
Yeah.
So I'm going to put fat in my belly because it's like Siberia and it doesn't ever come out. And
Yeah.
so like the body's like going into storage mode. So I always
Mm-hmm.
say, like, I want to keep my body in spend mode. So I'm spending the calories that I'm taking in. I'm not storing. So
Right.
is that
Yeah.
kind of how you think about it?
Yeah, I do. And I think sometimes it's almost like a twofold hit, right? So in one way, our body's saying, I'm gonna be in a weight gaining state, I like to say, right? Or not in a spending state, but a storing state,
Mm-hmm.
right? And then also we get signals sent to our brain that's like, well, maybe we should be a little bit more hungry. Maybe that donut looks a lot better on the office coffee table than it did yesterday, right? I can distinctly remember times that I was pregnant and I like could normally I'd walk past a bakery, not think twice. And then
Right.
once I was pregnant, all of a sudden I'd be like, oh my gosh, like that signal's different. I feel like I can't not walk past. And that's
Right.
those are the signals that we're talking about. Nothing changed with my willpower, nothing changed with the person of who I am and my personality. There was different signals coming to my brain that were kind of dictating my thoughts about,
Like we
processed
need to
food.
store calories to feed that
That's
baby.
right.
So that's
That's
why,
right.
and the
Yeah.
placenta makes those hormones like human
Right.
HPL, human placental lactogen. But yeah,
Yeah.
it's like telling the body be insulin resistant.
Yeah. And
And
so kind of getting over this idea that you could just run off any more calories that you could burn, and moving your mind space into more of this is a signaling issue.
right. And I think the more that we understand that, like you, I so want women to walk away from interactions with us in the office and say, okay, now I get it. Because, I don't know about you, I'm a bossy Dutch girl. I don't want anyone to tell me what to do, but just tell me why, give me some options. And
Right.
that's what I love about our conversation tonight. I think it's real clear why we do this. We love to help women.
Yeah.
And so I would love to go into some pointers about this in terms of, again, why do people hold on to weight? What are some really practical reasons why?
Yeah, I think one of the main things is a little bit what we talked about, our hormones not being right, right? So if I always like to think of if our body is a company, right? Our brain is the CFO, and our fat cells are just storing money that's in the bank, right? It's hard to get it in and it's hard to get it out. And basically, from a biology standpoint, our business is having babies. And so estrogen's kind of telling the rest of the company, like, what the heck's going on? Are we in the process of having babies? Should we have babies? Are we not having babies? Right. And that signal is kind of giving the rest of the body an idea of what's going on. So when we go through menopause, a lot of that signaling has majorly changed and the brain's not really sure what to do with it. And so we do end up storing extra adipose tissue, either around our organs, which we call visceral fat, and I think subcutaneous fat as well.
Right. So, again, too, I think we both think about it this way, but as that estrogen falls, it promotes storage of the belly fat. And so, which then leads to the chin hair and maybe balding and all these other things that we don't like. What other reasons, like, might we have? What if a woman, for example, had diabetes in pregnancy, or she's got a family history of diabetes? How does that affect her holding on to weight?
Yeah, I think what you're hinting at is this relationship between blood sugars, the hormone to regulate blood sugars, which is insulin, and our adipose cells. A lot of it's not 100% nailed down because it's a lot of the chicken or the egg. What comes first? Do patients develop insulin resistance first in their liver, and that causes an expansion of their fat cells? Or do people have the expansion of their fat cells, which triggers an inflammatory process, which hurts the liver, which then changes the insulin resistance? We're trying to tease all that out, right? And the problem is it never happens in isolation. All of this is kind of happening at the same time, and it all kind of plays off of each other.
Sorry, my cat will not leave me alone. Sorry. I'm just going to go with it here. So in terms of thinking about weight loss, you and I, we could go down rabbit holes all night and talk about the physiology of this, and we can as we talk about the meds. But as you think about, how do people get started with a process of weight loss?
Yeah, so I think of approaching it in several different ways, and we're actually going to throw up our pyramid that we use a lot at True to kind of help women get a sense of what's going on. So first and foremost, we need to get a handle on our relationship with food, and this is our mindset. So our relationship with food, and honestly, the relationship with our outside world, right? If we're in a constant state of stress and really stressed out about our relationships with either our partner or our kids or our job, it's really hard to focus on making good food choices and really feeling our body. So, getting a handle on our mindset. The second piece is really optimizing our nutrition. And we talk a lot about seeds and getting in good, complex carbohydrates, proteins, fats, and all of our fiber. And I think that's a great place to kind of get started and begin to, in a beginning way, to organize our thoughts about nutrition. Of course, we like the use of meal replacements at times as a tool. for the times that we can't always get everything we need from grocery store food. And then lastly, which we're going to talk a lot about tonight, is, optimizing medications and any hormones that we may need. The inside part of the pyramid, I'm just going to touch on it really quickly.
Good.
The inside part of the pyramid, which is sleep, serenity, and getting into our serenity and getting our stability, heart strong, muscle strong. Those things are super important, which we've already alluded to, but it's really tough just to work on that in isolation. You really need to work on our relationship with food, getting our nutrition right, and getting on the right medications. And then, the next tier is then optimizing all those other things next.
Right. And what I love is how one thing affects the other.
Yeah.
So in terms of, Missy, can you put that triangle back up, the pyramid? So it has to do with, like, as your mindset is better, you can look at your meals better. As your meals are better, it might help your mindset. As your medications and hormones are in order or all balanced out, then it makes the mindset and meals better. It's just understanding that it's all these pieces. And sometimes people, of course, we all want the magic bullet or the magic wand, but it's really looking at all these three. And again, when patients come into True, I just love that we really segregate out these concepts and address each of them as it might play in. Don't you think?
Yeah. And it may not seem as obvious in the visit, but we really do think about all these things, and we try to ask questions surrounding them. We document on them to make sure that we all understand where a patient's coming from all those different aspects. And a lot of different programs, commercial programs, optimize these things as best they can, but there's no place that I know of that kind of does all of it at the same time.
I know. That's what I just love about what we can do. And so would you like to go through each of the common meds? I mean, my sense is that there's three main groupings of the medications.
So there's a lot of different medications that can be used. Well, there's three kind of main classifications that can be used to lose weight. So the first medication, which has kind of gotten the most press in the past year, is this group of medications called the GLP-1 agonist. And this goes by the brand name Wegovy or Saxenda. So what this drug does is it mimics one of our common hormones. So all people, when we eat, particularly protein and fat, there's a hormone that leaves our GI tract, again, like a signal that goes to our brain and the rest of our body. And it's like, hey, we got food here. So brain, don't be so hungry. Fat cells, don't hang on to so much energy. Release some of that. And it kind of tells the rest of our body what's going on. This drug, Wegovy, mimics one of those hormones. So when people take it, they say, I feel full quicker. I don't feel as hungry. A lot of my patients talk about their relationship with food has changed. They just don't quite have the same, like, oh my gosh, I'm really pining for that takeout, those chips, those crackers, whatever, right? And they just feel like they find a little bit of peace with coming to the table.
Right. I had a patient recently that we see together, of course, our patients at True.
Yeah.
And she started with Wegovy, and she's lost a significant amount of weight. And she's a teacher, and she's got younger kids. And she said, I'd make them food, and I'd want to eat the leftovers or eat the crusts or eat the bowl of the macaroni. And she said, I don't anymore. I had my food and I'm good.
Yeah. I think that's like the main takeaway that I get from people. And it's not, a lot of people ask me, is it just a hunger suppressant? And I'm like, it is, but there's like another piece, there's another layer on top of it that's really, really helpful. And it's actually pretty well tolerated. So the main side effect, because it interacts so closely with our GI tract, is nausea. Some people get some constipation, some reflux, but for the most part, it's pretty well tolerated. It's worse if you take a big meal, but most people don't feel like eating big meals, so that's okay.
Celia, just a sec. So Diane, right there, number one is the medicine we just mentioned.
Wegovy is the last name. Yeah. The biggest barrier to starting this medication, honestly, is insurance. So, if you're thinking, if this sounds like a medication that you'd want to try, looking at your health insurance plan to see if it's covered. And we're sort of the insurance pharmacy ninjas. Dr. Bitner hears me all day talking logistics of getting people these medications. So, but it's always a good position to get this covered. So I know Cheryl just asked, how do you get this covered? The best, so first of all, you can definitely pay out of pocket, although it is pricey. Usually it's working with your health insurance and seeing if that's part of the coverage, and then maybe changing if you need to a different plan. So Lisa just asked, are these medications covered? They depends on your insurance plan. The Blue Crosses tend to cover them the most significantly.
And so, and then isn't it, I've heard you talking too, isn't it something to do with employers? Some employers have that
Yeah.
covered on their plan.
Yes. Employers can opt out of obesity medicine. As of right now, employers can opt out of obesity medicine coverage. So that's just, again, something to review with your health insurance plan to see what is covered, or with your HR department. There is a coupon, I think, for about $250 off, which is, a significant portion off, but sometimes cost is a barrier for people, for sure.
It is. And what I love too is you have other options. So this is the latest and greatest, right?
This is the latest and greatest. Yep.
Other options, and I've seen patients be very successful on the other options. And you said Saxenda is also in this class?
Yeah. So there's another medication called Saxenda, which is like kind of a cousin of Wegovy, also works pretty well. And we see a lot of good results with that as well. Basically it's the same drug, just a little bit of a different molecule.
Sure. Stephanie asked about availability. Do you want to address that, Celia?
Yeah, we're just laughing. So the drug company Wegovy actually is struggling just literally getting the supplies of the drug that it's supplied in. So there's nothing wrong with the medication. It's completely fine. But like everywhere else, kind of what it seems like, there's a supply issue. We're hoping that resolves in the next couple of months, but people still seem to be able to get it as of now.
Oh, good. And Marie asked if these medicines are addictive.
They are, as far as we know now, they're not addicted, and that is not anything that I'm worried about. If anything, I would make an argument that they help with the reward processing. And a lot of people talk about turning down things that are part of that reward system, such as alcohol and sugars.
So it helps with people who might maybe not be addicted, but again, just constantly thinking and obsessing.
Yeah, but I definitely would not say that they're addictive. No.
Okay, good.
Yeah.
Do you want to talk about the next class? Was that number 2?
Yeah, Qsymia. So for a while now, for a long time, the obesity medicine doctors have been using off-label 2 medications for weight loss. One is phentermine and the other one's Topomax. They put these drugs together and made a combo pill called Qsymia. So together, this medication works pretty well. It's a newer drug. I think it was approved about 5 years ago or so by the FDA. But again, we've been using the other active ingredients a long time off-label. Phentermine is that medication that was part of the drug fen-phen from the 90s. It was the good part. So fen-phen from the 90s was phentermine and ephedrine. Ephedrine caused a lot of heart issues, and that's why the combo drug was pulled from the market. But now it's safely used as part of the drug Qsymia.
And how does it work? How's phentermine work?
Yeah, so both Topomax and phentermine work on different parts of our hypothalamus. Hypothalamus is that part of our brain. I always make a joke. It's like the CFO. It's making the decisions about what our energy storage should be, right? How much money do we need in the bank? And a lot of times we see things in our hypothalamus change. They've actually seen this in MRI studies with things like traumas, different medications. And what's really interesting is we think that when these changes happen, that sometimes they can be irreversible. And it takes a drug like phentermine to get our body into a weight-losing state.
That makes sense. And Topomax, tell me about that. How does that work?
Similar concept. It works in the hypothalamus at a different receptor than phentermine, but it's also in the hypothalamus. Topomax is used for a lot of different things: migraines, seizures, a mood stabilizer. It's, out of all the drugs, Topomax probably has the most side effects. Some people can feel a little mentally foggy, but that's mostly dose related. So when people take it for seizures, they're taking it at about like 400 milligrams a day. I give people a sprinkle. I say like 25 to 50 milligrams a day. And people tend to do well. A lot of people talk about just sugary stuff just doesn't taste as good as it did. It kind of just isn't as, flavorful on the tongue. People say carbonation really kind of tastes goofy, which is kind of a funny side effect. And I think the biggest barrier for a lot of women is that there are fetal side effects of taking Topomax. So if a woman were thinking about having kids, that was in the realm, we definitely 100% do not start it.
I can
I
put an
think
IUD in. We can take care of that.
right. Right. But just a warning. I feel like I'm doing my doctor due diligence of saying
Yes.
that
No, I
100% that's what we have to do.
Awesome. All right. And category number 3, Contrave.
Contrave. So Contrave is a drug that was approved again about 5 or 6 years ago. And it's also a combo pill of bupropion, which is also known under brand name Wellbutrin, and this drug called naltrexone, or a brand name called Riva. So this is really works at the reward system. So again, I know we've talked on previous podcasts about that ping to eat, right? So there's the ping to eat, that's hunger, and my tummy's growling, and I haven't eaten in hours, and I'm hungry. And then there's just cravings. That's the I wants. I want sugar, I want salt, I want a crunch. That's where Contrave really works at the craving. So when people come in, they're like, I feel as though I'm eating pretty healthy all day, but at 3 p.m., 8 p.m., I can't get my hand out of the pantry, out of the cookie bowl, then we really think about using Contrave as a great choice. You know, the bupropion is also used for depression. We also use it for patients trying to quit smoking. So
Look
we
at
know
that obsessive compulsive.
yeah, this reward center pathway is really on fire when people are really struggling to make these good food choices. And then naltrexone, very interesting enough, is actually a opioid blocker. And we also, that's what's in Narcan, which we use for to block opioids. And it's basically working at the downstream effects of all these reward center pathways just to blunt that response. It's not quite the same as Wegovy and Qsymia in terms of changing our sugar recommendations, but a lot of people just feel comforted, you know, with those cravings. I mean, having a craving is kind of like listening to a screaming toddler in the room. You're just like, oh gosh, just get it to stop, right? And we have an answer and it's there. And so it's just so easy just to feed our cravings.
Mm-hmm.
But if we can just turn that volume down a little bit on the cravings pathway, it just makes making a food choice just a little bit easier.
Sure. And I know you and I didn't talk about this before, but talk to me about, you know, metformin and treating insulin resistance. I mean, I know building muscle mass is so key to helping with insulin resistance and improving insulin sensitivity.
Yeah.
But just in terms of actually treating the insulin resistance, how would you do that with these?
So I think something to think about insulin resistance. So insulin is a hormone that is at most cells in our body, and it's kind of there to triage who gets sugar, what and when and why, right? And what insulin resistance is basically the cell that's there is not responding to the insulin that's there. And we figured out there's problems at the receptor. The paradigm is that insulin, the receptors aren't working at only select cells. So we really see that there's a misfiring of the insulin receptor at the muscle cells and at the liver cells. And what metformin does is it basically unflips those switches and gets the insulin receptors working again. And we know that insulin can cause expansion of basically adipocytes or expansion of fat cells. So if we can just get the insulin working where it's supposed to, then we in theory won't have as much of it. Then the fat cells just won't hear that signal to expand, right? And that's kind of the backbone of like the insulin resistance model with gaining weight. We do see weight loss with metformin. It's not FDA indicated for weight loss, but we all as doctors know that we put people on metformin and we sometimes see a good deal of weight loss.
Right. And I think it really helps, you know, if nothing else, sometimes it even helps the cravings in terms of not having, right, those insulin response is how I think about it. But again, that's not my lane. But just in terms of how a woman processes it. And as she goes through midlife and menopause and losing her estrogen, again, you know, we think that's one of the big pathways of why people gain that menopause or that belly fat, but also, of course, sleep deprivation. So I guess last question, maybe before we go into our next part is like, you know, how does sleep deprivation and, you know, fatigue and stress, how does that impact our cravings?
Yeah. So if you're going back to kind of the signaling model, and I think, you know, we will pause after this and probably answer some of the questions. I know there's a bunch of questions that kind of popped in. If you go back to the signaling model and we're thinking about our hypothalamus, again, the hypothalamus is the CFO. She's deciding what the rest of our body's money situation will be, right? If we're not sleeping, if we're constantly in stress mode, cortisol surges all over the place, right? That CFO basically sends two signals. One to our fat cells to say, for heaven's sakes, do not shrink, right? You stay exactly the way you are, if not get bigger. And then two, it sends signals to basically our consciousness to be like, crank up that hunger, crank up those cravings, go to the vending machine right away, right? I know Dr. B and I both have, worked long hours in the hospital, and after on call, like you just like feel like insatiable that you could eat 4 omelets, right? And so what's happening is that hypothalamus is basically trying to recenter everything from the signals of not getting sleep and high stress. So, that it's kind of like a twofold hit. So not only do you get the biochemical pathway that's telling our body to have fat expansion, but then we're sending all these signals to eat foods that further perpetuate fat expansion.
Right. So again, back to you don't have to put the triangle up, but back to the triangle. It's like we really want to look at everything in terms of these medications in combination with mindful eating. But again, when you have that screaming toddler in the room, you can't read a chapter in a book, right? So if we can help use these medications to calm the cravings, then I really see people move into more mindful eating. They're able to work on their sleep. They're able to work on the relationship with food, because these stressors are not going away anytime soon. So it's, how can we address this? One thing I know you wanted to talk about today too is just even some other examples of some success stories. So I know you were talking about a patient today. Right.
I have someone who, a postmenopausal woman in her 50s, and she was started on phentermine, and, she's lost a good deal of weight, and she's of course eating healthy. She's working on gratitude thinking, metered breathing. She's doing her strength training and exercise. She's doing all the other good stuff.
Taking hormone replacement therapy.
She's also on hormone replacement therapy. And she just said the phentermine is just making her journey a little bit easier, a little less snacking. And it's not snacking like, oh, she's like torturing herself. She just feels content without it. And that's really where we want to get people. I mean, honestly, I can get anyone to lose weight in 6 weeks and starve them, but is that the right answer? I don't think so. And I think science is showing us that is definitely not the right answer, right? Not only that, but like, who wants to come be starved for 6 weeks?
Exactly. So no, we want people to have lifelong tools that they can take away from this program.
Yeah.
And so I would love you to talk a little bit about the expectations, as people come into our programs, like what to expect, like what does it look like when someone comes to True?
Yeah. So, if you come into our office and, so a lot of the indications for weight loss medications have a lot to do with your BMI, and then any medical problems that stem from having extra weight that you need to lose. So some cutoff numbers are, anyone who's a BMI of greater than 30 is a candidate for weight loss medications. Or if you have a BMI of 27 with a comorbidity such as high blood sugars, high blood pressure, high cholesterol levels. And, we stand pretty closely by those. I will say though, if someone has a BMI of 26 and they have, pre-diabetes and they're gaining weight, I may pull the trigger a little bit sooner to start a weight loss medication, because it's silly to wait and let someone gain more weight, and so we really try to do a deep dive into what's kind of preventing a woman from losing weight and seeing what they need at the moment.
But also I think we both share, we want women safe first, and
absolutely,
and also to have informed consent. So I love how we all at True, we talk about what are the pros, what are the cons, what are the risks, what are the benefits, and we really want women to be informed. And I just love, just like for menopause, we've developed a very, women they actually get a binder with all this information in it, right in black and white. And you've done the same for our patients in the weight journey, is to have this very clear booklet, all this information. So it's not like you leave the appointment and say, what do they talk about? It's all in your hands.
Right.
Pauline, I see you've asked this question twice. Celia, do you want to look at?
I'm 72 and need to lose weight. Can I take the pills? A lot of it depends on other comorbidities, and there are some contraindications to all the different classes of medication. So this would be really a patient-provider discussion about whether or not people can take medications.
Yeah.
By no means is age a strict contraindication, and we really work on a patient case-by-case basis to find the right medications.
Yeah, Pauline. So again, it's just so important to come in and have a consult, to face-to-face see a doc. Again, why we're so proud to have Dr. Egan in our practice is that she is board certified in obesity medicine. And she works with Rebecca and Nancy, who are trained in these meds. They are able to answer questions even after hours. I mean, you're getting a doc who's board certified in obesity medicine. So it's really important to have her look at all these different factors. And Suzanne Pettigrew, our PA, is also working with Dr. Egan, to really provide this full service. And it's not all cookie cutter, right, Celia?
It's not. And I think that's why we developed, why I love working with Dr. Bitner is that, like, we both kind of just said, you just can't just, write down exactly what you should do for every person, because it's very personalized, even down to our nutritional recommendations. I think we make kind of in the office game day decisions about where to get started with nutritional recommendations. And so the medications are no different. You kind of have to figure out a person's story, hear their weight journey, and kind of what their goals are. And then we can kind of come up with a plan to move forward.
Exactly. And so, looking at the insurance, again, it's looking at everything all together. So I think the best thing is to move. Do you want to move into our 5 tips?
Yeah, I'm just going to answer some of these. There's a bunch of other questions here. Let's see. As of right now, Medicare does not cover a lot of these medications. Out of pocket, Wegovy runs as of right now, about $1,600 a month. Saxenda runs about $1,200 a month. We have some kind of goofy things we do to maneuver around that, but that would be a patient by patient basis. Qsymia is actually less expensive because it's been out. Both Qsymia and Contrave are both less expensive because they've been out for a while, and those run usually a couple $100s a month. One of the good things about those 2 medications is there's a lot of off-label uses from generic medications that we kind of use to get over some of the insurance issues. And if you have an in with your HR department, it's always great to bring that up, because the more people that start complaining about why these drugs are not covered, the more that they'll be covered for people. So if you have an HR ear, go squawk at it and let them know that you want your weight loss medications covered.
Exactly. And I just think about how important weight loss is for overall health and productivity and sleep and just overall
all of it, right?
Depression, anxiety. It's so important that companies pay for these medications. So again, the squeaky wheel gets the oil. We have to keep asking. And even if an insurance doesn't cover, we still submit. We want that insurance company to know that we keep asking. And so then maybe at some point they'll listen.
And would the insurance company cover if you have sleep apnea? Yes, that's usually one of the recognized comorbidities for BMI requirements. A lot of times once your insurance covers the medications, it's usually not a BMI comorbidity issue. It's usually much more of just getting it covered or not. It's kind of like a yes or no question. And then we have tons of appointments. So whenever you'd like to come in, we're here, we're open and ready to see people.
Yeah. So Judy, how do you get an appointment? You go on the website and truewomenshealth.com and sign up for Celia. Is it that easy? Sign up for the program, and then Elizabeth or Jill will give you a call. We'll get that appointment scheduled and you'll come in.
Yeah. And then you do not need a referral. You can just give our office a call, and insurance does usually cover the appointments if you're struggling with being either overweight or obese, which is a BMI greater than 25. Sometimes, the insurances will get a little concerned if your BMI is normal and we're talking about weight loss medications. But again, we really wouldn't necessarily talk about those if your BMI was under 25.
Exactly. And everyone, keep the questions coming in as we talk. We're just going to go through a couple more points to make sure we're covering all the basics. So we love to always include the 5 tips that we want you to walk away with. So tip number 1.
Am I a candidate for weight loss medications? Again, this is, anyone who's struggling with extra weight that they need to lose with a BMI greater than 30 or 27 with health-related issues. So sleep apnea, high blood pressure, high blood sugars, high blood lipids or blood cholesterol levels are some of the most common, or osteoarthritis is another major one, like knee osteoarthritis, hip osteoarthritis is another major comorbidity. But again, some of these, if you're gaining, you don't quite meet those requirements, this would be a patient case-by-case basis.
And you know what makes me crazy again is that women suffer and think, oh, next year I'll do this, or 6 months I'll do this. You know, it's like, wait for what? To gain 20 more pounds. I mean, where it just even gets harder. So it's just, you know, I want women to know they deserve good care. They deserve options. And
not only that, but I think Dr. B, I think, you know, I see a lot of women that come in and they just say, I just don't have enough willpower. And I'm like, it isn't that, right? Like, and we go through all the different reasons why they do have a ton of willpower, right? But again, if these signals are not right coming from your brain, and some of it has nothing to do with you, right? It's the way that our food system is. It's the stress level in your life. It's maybe your job and what you need to do to provide income for your family. Some of it was laid down actually in utero based off of the things that your mother ate, and honestly has little to do sometimes with your choices. And so it's getting all these signaling right to get your body into a weight losing state, but being, you know, self-forgiving about our food choices and just kind of making this journey a little bit easier.
Yes, it's just so many women have so much shame about their weight, and they don't need to have shame. And Joy and Amy, thanks so much. We love what we do, and we always say we're the shame-free zone. I had a patient the other day say, I didn't want to come in and see you because I wanted to lose weight before I saw you. I'm like, we are here to solve problems, not to judge. Like, it's all good. It's like saying you want to clean your house for the house cleaner. Like, no, come in. Or you don't want to shower because you're dirty. You know, anyways. Okay. Tip number 2.
Go on forever. Yeah. Okay. What is the role of hormones with this medication? So, you know, I think we're more and more realizing that the combination of hormone replacement therapy as a woman's, you know, going through that transition of menopause and using these medications seems to be, you know, it's safe. I mean, we can't say that there's a ton of data, but as far as we know that they're safe and there's no contraindications for the use of these medications together.
Exactly. And it's just so important. We know that, for example, you know, hormones are so much safer than most women think. And studies such as the KEEPS trial, the ELITE trial show that women who take hormone replacement therapy, if it's safe for them and they take it within the window of opportunity, it can maybe even reduce their risk of heart disease. It can reduce their insulin resistance. They have better control of their blood sugars, even if they do have type 2 diabetes already. So, you know, again, we've got to know you, do a deep dive in your health, and help offer you some options.
But I don't think hormone, I just want to make very clear, hormone replacement therapy is definitely not a contraindication to using these medications.
Perfect. And Maria, how about a woman with estrogen positive breast cancer? We know that estrogen doesn't cause breast cancer, but if you have had a cancer with estrogen, with or without estrogen receptor positives, taking hormones is not an option. Now, vaginal estrogen might be an option, but estrogen in your blood via a patch or a pill would not be safe. But again, that's even more. If that's you, then again, these other medications can help you where we can't use estrogen. These medications can help give you options to still live the life that you want to live. I mean, breast cancer robs women of so many things. Sexual health causes weight gain in terms of early menopause and going through the stress of treatment. So again, having these medications and these options can be such a great option if taking estrogen, for example, is not an option for you.
Yeah. And in terms of breast cancer and the weight loss medications, there is no contraindications.
Good point. Number 3, how can these medications assist my lifestyle changes?
So again, a lot of us are, you know, it's January, we have our New Year's resolutions. All of us are saying we're going to eat healthier, right? And whatever that means. And again, when the toddler's in the room screaming at the end of the day because, you know, we tried to eat healthy all day, but we had a stressful meeting or a whole series of stressful emails, right? That toddler's still quite loud, right? And all we want to do is just turn that volume down. And so there we are in the pantry having cookies and chips and all those, and
or that second glass of wine.
Right? That's right. These medications just turn that volume down on the cravings, just make it a little bit easier to get on this journey of eating healthier, right? And that's how
Right.
they can be helpful in assisting lifestyle changes. And
Perfect.
then there's a lot of the positive feedback, right? If you lose a little bit of weight, I don't know, exercising feels a little bit better, right? It's a little bit easier to go back out there and exercise. And maybe we're sleeping a little better because we have a little extra weight off of our airways. So again, it just kind of helps starting up the health train of moving it forward.
Exactly. And, it makes me sad when, let's say, couples are snoring and now they're sleeping in different beds and they're not feeling as good about themselves and they don't feel as close. It's like all these factors are so interrelated. So if we can just start somewhere. I had a patient recently who so did not want to have to get a CPAP for sleep apnea. I'm like, look, if you look at it as a tool, you get the CPAP, you treat your sleep apnea. Now you're sleeping better. Now you lose weight, you get rid of the CPAP. But we've got to start somewhere. So these medications can be the trigger for you to get everything started.
Mm-hmm.
So tip number 4.
Side effects. A lot of the side effects are usually GI related, right? So the GI tract's pretty big in this whole process of processing food and energy. And so a lot of the main thing is nausea, is what we see from a lot of people. Topomax tends to be the one that has the most side effects, with feeling a little mentally foggy. Some people get some tingling in their fingers, but for the most part, we can kind of expect to have some GI side effects, changes in our bowel movements, either constipation or a little bit more loose. And it really varies per person.
Cool. Thanks. And number 5?
How long can I expect to take these medications? I think this may be like the number one question we get from people. Again, thinking a little bit about that signaling process, right? So everywhere from our brain to our adipocytes, there's a misfire of that signal that's causing your fat cells to expand. For some people, that may be a long-term plan to take a medication. For some people, it's a short-term plan until we can get some of these factors in our life back in order. But at least we tell people at least a year. We should expect to take this for at least a year to sort of see where things go. And that's usually about how long it takes for women to get kind of to their weight goals or kind of get going on some sort of plan.
Cool. That makes sense. Okay. So the next section we always like to do with Let's Chat is 5 questions we want you to be able to ask your healthcare provider. So if you don't live in West Michigan or in Michigan, by the way, we do provide telehealth. So even if you're over in Detroit, I know there's a bunch of you listening from Detroit. If you're over there and, we want you to come in for at least one visit, but then we can definitely provide this care via telehealth. But let's say you're not in our area and, we want you to have some questions you can go to your healthcare provider with. Sorry about my kitty's tail there. So here are some questions you can ask your provider. So number 1.
What is your knowledge of weight loss medication? So as you can see, there's a lot of ins and outs and nuances that go into weight loss medications. I think having just that conversation with your primary care doctor about if they know about these, so there's some stigma around them just because, like I said, there's, with the 1990s of fen being pulled from the market, and there's some other drugs that have been used and pulled from the market. So a lot of times when that happens, a lot of doctors are like, oh, I'm not going to think about this at all, right? So you just want to make sure that they have a good understanding of really what's the most up-to-date recommendations for these meds.
And again, I think this is so important. You deserve to know the answer to this. You wouldn't want to be told, no, you can't have hormones if it's just that the provider doesn't know about hormones, right? So the same sort of thing. If you have a provider that says, I don't think those medications are safe, but yet they don't know about the medications. Again, all of us healthcare providers, we can't know everything about everything. So if you came to me to ask about these, I'd say, go see Dr. Egan. Not my lane. Like, I wouldn't want to do the wrong thing. So again, if your provider doesn't know about these medications, that should not be a reason you don't get them. So you've got to ask, like, own it, empower yourself. We want you to be empowered to ask these questions. Question number 2.
What is your knowledge of the insurance logistics behind getting these meds? So we've already even spent a good chunk of time kind of talking about the ins and outs and the off-label uses of these. It's unfortunately not quite as easy as just writing a script. So, just make sure that they know kind of where people can get these medications and how to get them through the insurance prior authorization coverage.
So yeah, it's important. Again, we don't want you to be turned away because there's not knowledge of the insurance ins and outs, or they don't have time or space to be able to deal with that.
And a lot of times, honestly, it's silly things like just dotting the T's right and I'm sorry, dotting the I's right and crossing the T's. And so what we hate to see happen is someone's denied something for actual clerical error.
Exactly. All right. Question number 3, we want you to be able to ask.
Where can I find an obesity medicine physician? So if you're not living in the, Michigan area, you can actually go to the American Board of Obesity Medicine website. And it's flagged right there. And you can find a provider in your area in case you wanted to find someone locally that had knowledge of these medications.
So again, just like you can go to the website menopause.org and find a certified menopause practitioner, which again, now Dr. Egan is a certified menopause practitioner.
That I am, yeah.
Yay. So, but I am not becoming a obesity medicine doctor. But anyways, so just like that, it's good to, again, to really recognize the expertise and make sure you're finding someone you deserve to talk to an expert. Question number 4.
What is my target or goal weight loss? I think that this question is really interesting. This is probably the number 2 question that I get. We talk about weight loss in terms of body weight percentages. So, our goal, believe it or not, for from a medical standpoint of losing weight, we talk about even just getting and maintaining 5% body weight. So for a woman that was 200 pounds, that would only be like 10 pounds, right? That's what that means. These drugs tend to target a little bit higher than that. And the best is the drug Wegovy. In the clinical trials, we've seen women lose up to 15 to 20% of their body weight, which is pretty impressive. Again, for 15% for a woman who is coming in at 200 pounds would be like 30 pounds. Mm-hmm. But really, trying to set expectations about how much weight patients can lose. I think that, getting down to your weight that you were when you were 21 may not be realistic. And so we really try to help women kind of understand what those target weight loss or what your goal weight loss should be. And we really want to look a lot at what we're actually losing. But we hear a lot about your muscle mass percentage and kind of keeping that number high while losing just body fat percentage. And even that, kind of flipping those numbers where your body fat percentage and your muscle mass are back within the normal ranges is even a win for us. Wouldn't you say that that's true, Dr. B?
Yeah. So I had a patient who came in and let's say her weight was 145 and where she normally would feel comfortable would be like 125. And so she said, okay, I want to weigh 130. And so we looked at her body fat percentage. So in all of our rooms at True, we have the scales that measure your body fat percentage, your visceral fat, and your muscle mass, as well as your BMI and your weight. So a year later, she's gone through some different options. And what's really cool is she's been able to engage in healthy eating and healthy lifestyle. And she took a medication and now her percentages are flipped. So she had a high body fat and a low muscle mass. And her weight was, again, let's say 145. Her weight now is like 138, but her numbers have completely flipped. So now her muscle mass is like 31% and her body fat is like 25%. So she's like, I'm really okay with 138 because I feel great. I fit in my clothes. I'm strong. I can hike. I can keep up with my teenage kids and I'm fitting in my jeans. So I don't care about that 138 because now I know and I can see how my numbers have flipped.
Yeah. I always make a joke for a weight loss doctor. I actually care about weight the least. I love, we like waist circumference, body fat percentages. Honestly, I care a lot about women's relationship with food, right? If people come in, they're like, you know what? I feel really settled with food. I feel like I'm mostly able to eat healthy. Sometimes I'll have my treat, right? But for the most part, that screaming toddler has really calmed down and I feel like I have control over my relationship with food. I feel like that's a win. Right.
And I had a patient who came in and she just said, I want to be a good example for my kids. Like, not only do I want to look healthy and be healthy, act healthy, but I want to talk about food in a way that is healthy so they can learn this from me and then go out into the world and be okay and not struggle when they're 45, 50, like I am struggling now.
Yeah. I think that that's a great goal as well.
Perfect. Question number 5.
What other markers besides my weight can we measure? So we talked a lot about waist circumference, body fat, muscle mass, but honestly looking at your blood sugars, your blood pressure, looking at your cholesterol levels, particularly our triglycerides, can be really an indication that our metabolic state is really where it needs to be. And again, if your weight is not really changed as much as you'd like it to be, but all those other things are better, I think that that's a win, right? And I think it's really helpful to monitor those things throughout this journey.
And, one thing we're starting to do at True is using the Boston Heart method of measuring the breakdown factors of cholesterol. Do you want to talk about that just for a second?
Yeah. So we're really excited because we're just kind of just getting into this, and our staff's just learning to draw the blood and getting all this ready. But when we look at cholesterol numbers, it only tells a piece of the story of what's going on with the basically the fat content of our blood. So our GI tract and our liver makes packages of protein and fat together, and that's what we kind of commonly call cholesterol. But we know that there's so much more to that story than just those basic numbers. And really looking at what makes the size, the shape, and what makes up those protein and fat molecules can be really indicative of a higher or lower risk of having cardiovascular disease.
So we use these mainly to decide, right? Mainly, do we need to recommend a certain medication? Do we need to focus on a certain dietary change?
Yeah.
So again, we don't order these. Sometimes they're fun just to get for fun, but mainly we're ordering these tests to help make a decision.
Yeah.
How can this help you be motivated to change your diet, maybe to a plant-based diet before you take a medication? So again, we're really looking to help people do that deep dive into how to make decisions. I remember 10 years ago, I would get a patient's high cholesterol and she'd get sent a postcard, eat more fish. Really? So, so it was just that really quick advice, and the Boston Heart can really help us make better recommendations about what to do.
Yeah. And, I think, neither Dr. Bitner and I like surprises, right? And so what we don't like is to see people we do see this sometimes, completely normal numbers, but we see advancements of vascular disease. Boy, we don't like that, right? We really want to know what's going on with women before we see any of those kind of disease processes pop up. And so we really want to give all women a fair shot of kind of understanding of where they are at the best moment. So
exactly. And Connie Taylor, thank you so much for that shout out. True Women's Health is worth a drive to Grand Rapids. So again, we just love what we do at True. And now our restoration lounge is open. There's coffee and tea and water. If you just are between appointments, come hang out. We just love our space. For me, this is a dream come true. I've been thinking about this place in my mind for, 10 or 12 years. So to see it come to fruition. And today we were just bursting at the seams. We had Ashley, our therapist, seeing patients. Kara from iMove was seeing patients for physical therapy. Dr. Egan was full. Suzanne Pettigrew was full. We were hopping, but we just had such a great day. And we get to do what we want, what we love to do. So Celia, any parting words?
No, I mean, just a reminder that, this weight journey, if you're not able to stick on it, there's more pieces to this puzzle, and, let go of that guilt, let go of the shame, and come on in and see us, and we'll help you figure it out. Right? Yeah.
Right.
All right, great.
And we'll have fun. And so everyone, please, our next Facebook Live chat is on January 26th. So Dr. Egan's going to be talking about from weight loss resolution to weight loss reality. So we hope you'll join us there. And for those of you who are patients of True, please stay active on our private Facebook page. It's become such a great place for our patients to support each other. And we're planning some office hours with us on our private Facebook page. And so, again, we really look forward to your engagement. And please let us know, how we can help and what we can do. So thank you, everyone. Stay safe. Have a great night. And visit us at truewomenshealth.com. Thank you.
Thanks.